Imagine waking up one morning and realizing you don't need to check your blood sugar anymore. No more finger pricks. No more insulin pens. No alarms. No fear of going low in the middle of the night. For millions of people around the world, that dream feels impossible. But in 2025, scientists are getting closer than ever to making it real. Through something that sounds like science fiction, stem cells, they're not just testing drugs anymore. They're growing new cells, new organs, even new hope. So the question is, can stem cells actually cure diabetes? Or is this just another overhyped promise that will take decades to come true? Let's find out the truth about 2025's stem cell clinical trials for diabetes. Part 1. The dream that started 100 years ago, a century ago, in 1921. Two young scientists, Frederick Banting and Charles Best, discovered insulin. It was a miracle. Before that, diabetes was a death sentence. After insulin, it became a manageable condition. But manageable isn't curable. Every day, more than 540 million people around the world live with diabetes. Most have type 2, where the body becomes resistant to insulin. About 10% have type 1, where the immune system destroys the pancreas's ability to make insulin entirely. For people with type 1, insulin injections are a lifeline, but they never stop the disease itself. They're just replacing what the body can't do anymore. And for decades, scientists have asked, what if we could replace those lost insulin-making cells and bring the pancreas back to life? That's where stem cells come in. Stem cells are the body's raw materials. Cells that can turn into any other type of cell. Heart cells, brain cells, skin cells, and yes, insulin-producing beta cells in the pancreas. If we could create new beta cells and implant them safely, diabetes might actually be reversible. Part 2. How stem cells could cure diabetes. Let's break this down in simple terms. Your pancreas has clusters of cells called islets. Inside those are beta cells, the ones responsible for making insulin. In type 1 diabetes, the immune system mistakes those beta cells for enemies and wipes them out. In type 2 diabetes, they often still exist, but don't respond correctly anymore. So the idea behind stem cell therapy is beautifully simple. Grow new beta cells from stem cells in the lab. Transplant them into the patient. Let them sense glucose and release insulin, just like a healthy pancreas would. And in 2025, this idea isn't just theory anymore. It's being tested on real people. Part 3. The pioneers, Vertex, ViaCyte, and beyond. One of the most exciting companies in this field is Vertex Pharmaceuticals. In 2021, they made headlines when a type 1 diabetes patient named Brian Shelton received the first stem cell-derived beta cell transplant. He'd lived with diabetes for more than 40 years. After the procedure, something unbelievable happened. His body started producing insulin again. For months, he didn't need external insulin. His blood sugar levels stayed normal. It was called VX-880. Vertex's experimental stem cell therapy. But there was a catch. Brian had to take immunosuppressant drugs, medication to prevent his immune system from attacking the new cells. And those drugs can have serious side effects, making long-term treatment risky. That's where ViaCyte, another biotech company, took a different approach. They developed tiny cell encapsulation devices, like microscopic shields. These capsules allow nutrients and insulin to pass through, but block the immune system from attacking the new cells inside. Imagine a tiny bubble protecting your new beta cells, letting them do their job in peace. In 2025, both Vertex and ViaCyte are running phase 2 clinical trials, testing improved versions of these therapies. And they're not alone. Dozens of startups and university labs across the US, Europe, and Asia are racing to perfect the formula: stem cells that survive, function, and don't get rejected. Part 4. The science gets smarter. Early stem cell therapies had a big problem: instability. Sometimes the new beta cells didn't work as expected, or they turned into other cell types. But recent advances are changing that. Using CRISPR gene editing, scientists can now precisely modify stem cells, before transplanting them. They can make them invisible to the immune system. So the body docent, Tethec team. Others are combining 3D bioprinting and tissue engineering to build tiny pancreas-like structures that can be implanted onto the skin. In 2025, Vertex announced a new line called VX264, designed to be a fully encapsulated system. No immune suppression required. If it works, it could be the turning point. The first functionally curative treatment for type 1 diabetes. No daily injections, no blood sugar swings, no immune system war. But of course, this is science. And nothing this big comes without challenges. Part 5. The harsh truth. What's stopping a cure? Let's be real. The word cure is powerful. It gives hope, but it also creates unrealistic expectations. So what's holding us back? First, the immune system. Even with encapsulation or gene editing, there's always a risk that the body could reject or destroy the new cells. Second, cost. Right now, each treatment costs hundreds of thousands of dollars to produce. It involves growing personalized cells in lab conditions that meet strict safety standards. Third, regulation and time. Clinical trials take years, and for good reason. Every patient's safety must come first. In 2025, these treatments are still in clinical testing, not yet available to the public. Some early participants show amazing results, insulin independence for months, while others still need insulin support. The data is promising, but not perfect. And for type 2 diabetes, it's even trickier. Since the issue isn't cell loss, but insulin resistance. Stem cells alone might not fix it. They'd need to be combined with metabolic reprogramming or gene therapy. So, are we close to a cure? Closer than ever, but not quite there yet. Part 6. What these trials mean for the future, even if stem cell therapy doesn't completely replace insulin for everyone. Its impact is already massive. For one, it is teaching scientists how to regenerate and reprogram cells knowledge that could apply to other diseases, like Parkinson's or heart failure. It's also changing how we think about chronic illness. Instead of treating symptoms forever, we can start talking about restoring function. In 2025, there are more than a dozen active stem cell-based diabetes trials around the world, in the US, Canada, Japan, the UK, and China. Each trial is testing new ways to make the cells survive longer, integrate better, and avoid immune attack. Some use embryonic stem cells. Others use induced pluripotent stem cells, reprogrammed from adult cells, avoiding ethical concerns. A few experimental therapies are exploring autotransplants, using a patient's own reprogrammed cells to rebuild their pancreas, meaning no rejection at all. And AI is even entering the picture, helping predict which patients will respond best, how many cells to implant, and where. We're not just replacing cells. We're building a smarter, self-learning version of the pancreas. Part 7. The human side of the story behind every clinical trial. There's a person who volunteered, often knowing it might not help them, but could help others in the future. People like Brian Shelton, who said, "If my experience helps others, it's worth it." There are parents who watch their kids check blood sugar 10 times a day and dream of a life without fear. Adults who carry insulin pumps and glucose sensors 24/7, hoping for a day they can take them off for good. For them, these trials are more than science. They're hope in action. And for researchers, every data point is personal. Many of them have family members with diabetes. Some are driven by the idea that one day, kids will ask what was insulin, just like we ask, what was polio? That's the emotional power of this research. It's not about profit or patents. It's about freedom. Part 8. What happens next to 025 to 030? So where do we go from here? Here's the timeline experts are predicting as of 2025 to 2026. Phase results from Vertex and ViaCyte stem cell trials. Early data looks promising. Some patients remain insulin-free for over a year. 2027 to 2028. Next generation implants tested, smaller, more stable, no immunosuppressants needed. 2029-2030. If results continue to be positive, we could see the first FDA-approved stem cell therapy for type 1 diabetes limited release, possibly for severe cases first. From there, the technology will evolve fast. Costs will drop, efficiency will rise, and what seems futuristic now could become routine in a decade. That's how medical revolutions always begin. Slow at first, then all at once. Part 9, the bigger picture, the story of stem cells and diabetes, isn't just about one disease. It's a glimpse into the next era of medicine. Regenerative medicine, instead of fighting illness with chemicals, will rebuild the body itself. Instead of managing symptoms, will restore normal function. In a world where millions inject insulin daily, a single successful cell therapy could rewrite medical history. Think about it. The first person cured of diabetes might already be part of a 2025 clinical trial right now, walking around with a functioning pancreas grown in a lab. That's not science fiction anymore. That's happening. Part 10. The truth and the hope. So, is there a stem cell cure for diabetes in 2025? Not yet. But for the first time in history, we're not asking if, we're asking when. The truth is, these trials are the real deal. They're not miracle stories or fake internet cures. They're backed by decades of research, peer-reviewed science, and real patient results. There's still work to do, more trials, more testing, more patience. But the foundation is here. And when that cure finally arrives, it won't just free people from insulin. It will prove that the human body, even when broken, can be rebuilt. From a single cell, we can grow a new beginning, a new pancreas, a new life. Because the end of diabetes might just start with a stem cell. If you found this video inspiring, share it with someone who needs hope today. The science is real. The progress is happening. And together, we're closer than ever to a world free from diabetes.